Hi, I'm Val Carlson. I'm a nurse practitioner at Rejuve Medical. I'm talking today about stress. Stress is part of our everyday life. We all have stress, and actually it's very important to have stress in our life. Otherwise we wouldn't get up out of bed, accomplish any goals for life, etc. And oftentimes we have stresses that we don't want in our life, but there's not a really good way of getting rid of all of our stress. That's not one of our goals. Sometimes stress can be overwhelming or burdening or chronic stress, and that really can affect our health in many ways. Our normal life may have stressors from family, work, school, and our bodies should be able to adapt to that. Our bodies are built wonderfully to have those adaptations that should happen naturally, but sometimes they don't happen. Sometimes our stressors are too big. Sometimes we carry around too many stressors. Sometimes there's other hormone issues that get in the way of how our bodies try and deal with those stresses, or there's other lifestyle problems present. So as we are stressed, if an incident happens, such as we have a loss of a relationship or a job, the first thing that happens is our cortisol levels go up. Our adrenal glands make cortisol, and that's actually very important for surviving that stress. Our bodies do that so that we can adapt to that. Really, it started with human history of having to run from the lion. A lion jumps out of the bushes, we have to run for our life. That's fight or flight. Cortisol levels go up. Instantly, our brains have this hyper reaction to that stressor and tunes out everything else. Our blood shunts from our main organs and goes to our muscles so that we can run. Our eyes dilate so we can see better. Our lungs dilate so that we can breathe easier. Heart rates go up, blood sugars go up, and actually insulin levels go up as well. We run, get away from the lion, and then our adaptation happens where those high levels of cortisol actually trigger the reverse to happen, and our bodies decrease cortisol back to normal. Now, if every day our lives, because of our jobs, have high cortisol states, like there's a lion in the office every day, those cortisol levels don't adapt anymore. They stay elevated. What happens is our blood sugars stay elevated. We have those cravings. We have those comfort foods that we want to go to, and that is a physiological craving. We have insulin imbalances, even if we're not diabetic. Cortisol works inversely with melatonin, which is our sleep hormone. So if we have high levels of cortisol all the time, melatonin drops, and now we have too low of melatonin, and now we can't sleep. So what happens over time is we feel buzzed, we want to eat those foods, we want caffeine, we're just trying to cope with that. After a while, our cortisol levels drop too low because our bodies can't maintain that high production level. Now we're flatlined. Doesn't matter how much coffee we drink, how much sugars we eat, those comfort foods aren't working anymore. We're exhausted, but we can't sleep. So what do we do about that? It's really important to help our bodies to adapt, and one of the ways that we can do that is with lifestyle. So we need to try and eat healthy, even if we have those cravings for the comfort foods, sugars, and starches. We want to try and get good quality and adequate amount of sleep. We want to de-stress. For some people that can be meditation, yoga, taking a walk every day, talking with friends, prayer, something, but we need to work on actively de-stressing. Sometimes we need to take a look at our life and look at what our stressors are. Can we change those? If we can't, we need to work on the other pieces. But if it's something such as a job that you really need to maybe think about a different position, or something's not working, then consider those possibilities for you. Let's say you're working on all of those pieces, you just feel tired, fatigued, you've gained weight, you can't lose weight, you can't sleep. Now what? Well, now you need to have that checked out. If you come to a functional provider such as someone at Rejuve, what we can do is take a look at your adrenal levels. Sometimes we test with saliva testing, sometimes it's blood testing, depending on the person, insurance, so on. But we'll want to look at where those cortisol levels are, and there's other hormone levels associated with adrenal as well. So we want to take a look at where those levels are at and then do something about them. Sometimes medications such as prescription medications are used, but more often we use supplements that are designed to help your adrenals actually function normally. Our cortisol levels are high in the morning and low in the evening, so there's supplements that help our bodies to adapt to that. Some of the supplements are actually called adaptogens because they really help do that. We also have to have adequate levels of vitamins A, C, zinc, and some other properties too for our bodies to make those hormones. And then at Rejuve, we not only work with testing for your adrenals, working with the lifestyle, exercise, eating healthy, sleep, and then the supplements, we also take a bigger look at how those adrenals and cortisol levels have affected other parts of our health, such as thyroid levels, male and female hormones, and other things. I've had many patients who have gone through the assessment piece and then treatment feel 100 times better. So if you're having symptoms of fatigue, insomnia, weight gain, inability to lose weight, and you feel that stress is the cause of that, come in and make an appointment and we'll take a look at that and help you out. Thank you very much.